Hi, everybody. Thank you for tuning into my first episode of this podcast, Inspire Me. And I have with me my first guest, Dr. Werner Eberhardt. Thank you so much for being here. Now, for those of you who don't know Werner, Werner has been leading, building, and bringing to market cutting edge innovations for over 30 years of his career. And Werner, you've spent most of your time in healthcare and life sciences, so the innovations that you've essentially built, they impact the lives of people like you and me. And so I'm honored to have you here and would love to give you the chance to introduce yourself.
Perfect. Thanks so much, Anu. Thank you for having me here today. So per my background, I did my PhD in life sciences back in the early 90s at the Max Planck Institute in Munich, working on protein analysis, and was in the industry, first pharmaceutical industry, and then with Lion Bioscience, a software company that really brought innovations to customers in silico at the time. And after that, I joined SAP. And during that time, I also did my MBA, my executive MBA back in 2013.
That's a very well-rounded background because you come from the science space and then you added the management knowledge and know-how to yourself as well. And what I want to explore with you today are some of the innovations you built and why are they important? What's the impact of those innovations? So maybe walk us through your top innovations.
Yeah, happy to do so. So maybe I focus on two. The first one was with Hewlett-Packard, now Agilent back at the time. In 1990, we introduced the first commercial lab-on-a-chip system on the planet, so to say. And lab-on-a-chip basically means that we were able to reduce all the processes with liquids and samples onto a single chip and doing entire analysis on such a chip. The impact is huge because imagine the savings that you can have with contaminated liquids, with sample sizes. You are able to analyze single cells, all aspects really important in modern life sciences as we understand more and more the molecular basis of diseases. And maybe the one example that you all can relate to, you might have seen the series The Dropout about Elizabeth Holmes. She claimed that with her company Theranos, she was able to build a chip that was able to do an entire blood analysis on a single chip.
Yeah, I know that was a bit of a corporate scandal, and this was highlighted very promptly in the news. And it's a pretty interesting innovation because when I was researching on that, and I was thinking about another area where this could have huge impact is if you think of geographies where healthcare resources or the ability to diagnose, have access to, advanced diagnostic equipment where that is limited, and to have the opportunity to just do that with small equipment, like literally with just a chip, that's pretty phenomenal.
You're exactly right, Anu. Imagine that you want to bring advanced analysis into remote areas of this planet. The amount of liquids that you need to cool to actually do the analysis, the standardization of the tests, the automation of the tests run by a fully automated instrument like the HP 2100 bioanalyzer, which we introduced at the time, which is, by the way, still available today. So all of that are factors that are really helping mankind, so to say, overall to be able to do the right analysis wherever it's needed.
Yeah, that's very fascinating. And what I want to discuss a little bit more with you now is you've been leading building innovations. And I'm curious to understand what would you call out as the key ingredients to being an innovator? What does it take to be an innovator?
Absolutely. So maybe before I go there, I also mention another innovation that
Sure.
I launched at the time. This time with SAP. This was the database, a real-time database for the analysis. First of all, the collection, and then the real-time analysis of cancer data. So something that hasn't been built before. So that's the first part that I want to mention as part of your question. Being willing to take a risk is the first ingredient. The risk to build something which never has been built before. Bioanalyzer is a perfect example. The first commercial lab-on-chip system, but also the first database that we built for the leading association of oncologists worldwide, the American Society of Clinical Oncology, was something which hasn't been done before. And it really took, and that's the second ingredient, you need to have experts who really are, and for experts from different disciplines, bring them together, and they need to have the commitment to make it happen. So at the time at SAP, those people were actually volunteers who did this basically initially next to their day job, and that was really fascinating. And then I would say, in addition to the commitment from the team, you need a commitment from the management, the backing, which we had at the time all the way up to Hasso Plattner, really being excited about the possibilities of his technology.
And, you mentioned, for example, that they did that as a side job. They literally did it as a hobby initially. And when you read on, the largest studies of key innovations that came out, even from 3M and others, most of the times it is people doing that out of a personal passion. So if I summarize what you're saying, the three key ingredients to driving innovations are being a risk lover. So, these are people that like to take the risk to spend their time and do this. The second is, you talked about bringing people together from different backgrounds. So being appreciative of diversity, I guess, is another important aspect.
Exactly.
And then the last one you said, which is this having a fabric or a support system in place, ideally provided by your company or even governments, if you think at the macro scale, to protect these innovators, these risk lovers, if you will. So very interesting insight there. So Werner, I've known you for a long time, and I remember the times when you've built up these teams of hundreds of people. And that's a very challenging thing to do, because how do you decide who's the right talent to work on something as mission critical as, for example, the Cancer Link platform? So tell me a little bit about how you built up these teams and what were the traits that you were looking for.
Yeah, excellent question. And I would really focus on the most important trait from my perspective. The initial people are absolutely key, because those must be really from a diverse set of skills, as we just discussed already. You need to have really absolute experts, because they lay the foundation for everything that is then done later during the course of the development of the technology. So if the foundation is not right, if the feasibility is not, you're not able to show feasibility, you're not getting anywhere, or you're getting in trouble later. And when I'm saying that, it's maybe the other aspects. So it's the expertise, but it's also the commitment that people need to bring to the table. So literally, I remember the time when some people were literally walking up to my desk and saying, "Look, I want to work on that mission. I'm really passionate about this." And some of those people are actually still working in that area. And I still believe, again, I basically my first job in the industry, I actually did my PhD analysis with Hewlett Packard. So Dave Packard at the time in 1960 said, obviously people come to work because they need to make money, but they also want to make a contribution. They want to accomplish something. And those are the people that you really want to have. They need to be hungry. They want to accomplish something. Those are the people you want to have.
When I hear you speak, it almost in my brain, the word halo effect comes up, because you find these champions, or if you look at people like yourself, who started up this initiative and this movement to build up this, cancer platform to improve the treatment of cancer. And it's interesting, because through that halo effect, you created this flood. You created this pull where people got pulled along, and that's carrying on. So I know some of these people that you're also talking about. They've stayed in this industry, and if it wasn't for you initiating that as somebody who was willing to take the risks to innovate, they may not have, potentially pursued that path. So I think innovators have a big halo effect. So that's a really nice summary of what you said. But not all times are easy, right? As you must have come across also some obstacles, and especially in large corporations, innovating seems to be quite hard because you also come across a lot of red tape, a lot of processes and rules. So tell us a little bit about some of the biggest obstacles you faced.
Yeah, it's spot on. So, as a matter of fact, in large organizations, sometimes people are not as hungry as in startups. It's not, from a culture perspective, there are huge difference. Maybe if I again refer back to the HP Innovation Days, actually they built a separate lab, HP Labs, just for that purpose, to make sure that they have an organization that is focused on that single purpose, bringing up the next wave of innovation that they want to bring into the mainstream company, so to say. And even at that time, the HP Labs was not, I would say, hungry enough to really build the entire portfolio of IP that was required. So we actually had to collaborate with another startup, Caliper Technologies in the Bay Area, to complement the portfolio. And so then the next obstacle for us, obviously, was the cultural difference between those companies. Having a startup working together with main big HP and the cultural difference then also created some trust challenges, I would call them. So that's part of it.
Yeah. And when you talk about these obstacles, would you say that was the kind of, if you had to sum up all these years, what would you say was actually the hardest phase of your career?
Yeah, good question. So basically, innovators and people wield talents to a significant extent. As a matter of fact, 30 to 40% of talents leave companies because they leave their managers. So there's that saying out there: people are joining companies and they're leaving their managers. That also happened to me at some point in time, and I guess it's happening to everybody at some point in time. And my advice would be to really watch out for yourself. So once you start spending sleepless nights for whatever reason, for a manager is not really ideal for what you need to accomplish, then you need to think about it and see what you can change.
You talked about sleepless nights, and this is a big topic today because mental health is gaining in importance, and more corporations are also becoming aware of how important that is. And I have also gone through these phases where it's simply difficult. There's you're undergoing constant change, and then yes, of course, like you said, that people do leave essentially managers, so you need good leaders, you need good leadership qualities. And what that essentially means is that the business will keep running, the economy will keep running. It's not up to one individual. So it's more important to protect your own entity, because even without you, the place will keep operating. But it's important that you find a safe spot and you remain healthy mentally for your family and also for your physical health. So at the time of your lab on a chip innovation and the CancerLink platform, was AI a big thing back then? Because it's a talk of the town everywhere today.
Yeah, as a matter of fact, it was for ASCO CancerLink because IBM launched what they called Watson. Remember, the technology winning in Jeopardy at the time, and so they were, I would say, a little bit ahead of the curve. So today we have much more capabilities with respect to that. So imagine you have that database with all that cancer data, cases that have been treated successfully, and you have a powerful technology like AI to really extract the know-how out of that and be able to interact. Even that has huge potential in future to help with cancer, but also other diseases.
Completely agree. I mean, I do AI for a living, so I'm pretty blown away with all the things that it can do. And tell me a little bit more about how would you even see AI? Do you see AI complementing a medical professional's therapy decision, for instance. Tell me a little bit more about that space.
Yeah, I can absolutely see this. So we actually built the beginning already with one of the another products where we also supported the company Roche with a diagnosis for a diabetes analysis, and we built a little chatbot, and the chatbot for patients was able to really understand, basically the different types of diagnosis, the different therapies, and was able to ask pointed questions back to the patients to really help them get to the next level and do the right thing with respect to the medication or the analysis that was done. For the cancer-like example, it's even more pointed. So if you really have a difficult cancer case, it's actually discussed in tumor boards, either in person in large cancer centers, or it's done remotely with experts from different medical disciplines, even from other centers. So this is typically what is done. So I can clearly see that AI at some point in time would have a seat at the table, would have basically be able to speak up in that tumor board and provide a point of view that is based on the analysis of all the data. So with CancerLink, we're able to integrate data from 50 different hospitals, leading hospitals, into that database, and basically inform the artificial intelligence with that data behind it. So it's so powerful. And it's from an interaction perspective, also for medical doctors, it's going to be absolutely the right way to go.
You spoke about almost two different types or aspects of AI. You talked about the chatbot, and then you talked about, the analysis that AI can do of large amounts of data. And the new hot topic just around the corner now is AI agents. Now, AI agents is just this idea of an even more intelligent AI assistant, digital assistant, co-pilot, whatever you want to call it. And this is not, the AI agents would be able to do things that are not just a linear end-to-end workflow, but really, and it's not just one conversation with a partner, but it's really analyzing data from multiple sources, completing actions, just as you and I would do. If you asked me to do a research project on a topic, I would have to consult different people, consult different source of information, and then come back to you, validate, go back, do some work again, and then come to you and present my final output. So similarly, the idea of these AI agents is a more advanced version. And what I find fascinating is, you summarizing it as AI having a seat at the table. And although, of course, I want to be treated by a human being, yes, I would very much appreciate AI supporting that medical decision, because it can calibrate so much more structured and unstructured data than the best medical professionals could do, because they just wouldn't have that insight, that transparency into all the data. So I think this is going to be a game changer essentially for us as humans. Let's continue on this path of playing out the future. Imagine we are in 2035. And what would be a bold vision for this space of healthcare? And what do you think my experience as a patient would look like then?
So first of all, obviously, this is something that's so close to all of us, because obviously health topics are super important to us, and especially in that area, we are facing as human beings, we are facing a significant challenge. Because if you as an MBA student would do your PESTLE analysis, you would say, okay, we have in many countries an aging population. At the same time, we have a shortage of medical staff already today. And the gap is actually widening because simply also the aging population effect. So I still remember an ASCO meeting when one of the experts showed the curve how in the US the gap between the number of cancer patients and cases and the medical staff actually widened over time. So that sounds for 2035 like a significant threat. Not even looking at the cost. So I think the technology in that regard will play a key role, like the AI agents that you mentioned. For sure, they will take over and be able to close that gap to some extent. being able to do part of the jobs where we all agree it's the right thing to do part of the advice, like I mentioned with the diabetes example, do this, take this over, and by doing so, make sure that the real medical staff can focus on the work that they only they can do. So that's part of it. Then secondly, it's about prevention. So we want to make sure that people get as long as possible healthy, old. And in that regard, prevention is the only way or the key way to get there. Yeah. And I think the AI agents and all the technology that we have today already helps us to stay more healthy. Give us signals. Look, you're doing something wrong here, and there's a risk here. Look at the heart monitors that we are all wearing with us already today. So prevention is going to be a key one. Beside all the other technologies, vaccination, the stem cell analysis, the gene analysis that is currently possible, and the changes that we can do there to the even to single cells. So all of those aspects will certainly change the way how healthcare will be delivered in the future.
It almost sounds like technology can help to eradicate these big diseases like cancer. I mean, I would like to make that optimistic assumption. Would you support that?
I wouldn't go that far.
Okay.
So as a matter of fact, MD Anderson, the largest and most prominent cancer center in the world in the US, launched a moonshot mission. It was almost a decade ago, and it's not as visible anymore today. Also in Germany, there is a so-called Vision Zero Oncology. It's a think tank of leading experts in that space that really try to get down the number of cases which are. And just to give you an idea, we're talking about every single German citizen that will get a cancer diagnosis sometime during their lifetime, every second person, and 1/4 will die because of cancer. And if you just look at the aging population, that's something that's going to be remains to be a challenge. So the art will be to reduce that number as much as possible. To completely eradicate it, I don't think that that's realistic. Again, just based on what we observed. But the objective to really reduce it as much as possible is already absolutely supportable, and it's a very noble mission that those organizations follow.
Completely agree. And I think specifically the innovators in this space, they need to be protected by governments and businesses, because they're not just out there, trying to stay ahead, keeping up with Silicon Valley here in Germany or something like that, but they're trying to actually do something that is really kind of life-saving. So I'm going to come back and tee this up with the three things you also mentioned earlier about innovations. This life mission, or this life-saving mission, is exactly why governments and businesses need to build policies and business policies and regulatory policies as well around three characteristics to really encourage that, a risk-rewarding environment, to really reward risk in your country or your company, and then create diverse pools of talent. This is a company strategy, but also an economic strategy. And then the third is to really create that system to protect innovators. Today, when I talk to a lot of people across, my network of different industries, a lot of people are sharing so much change in their industry. You heard, I'm sure you read about those massive layoffs in the tech industry many months and over a year ago now. People are just scared. People are scared of all these changes, and because the rate of change has increased. And now with AI into the mix since mid last year, where, ChatGPT became a big thing, people are even more scared. What is it going to do to my job security? What is your advice to people to keep away from this anxiety, or go through it better, processes better?
I'm absolutely aware of it. As a matter of fact, as part of my free time, we're also doing some seminars to help with that. But that aside, I think it's most important to step back, and because anxiety, fear is not a good advisor for whatever. So being able to step back for a moment and take time to really understand your needs. So what do you need? What makes you anxious in that regard? What are your wishes? Maybe we can even learn something from Chinese in that regard. Their symbol for crisis actually contains both the part which talks about the risk, the danger, but also the opportunity. So that's what crisis means. It means change. And if you look at that, you mentioned AI as an example. There's an opportunity in that to really understand, so what are my skills, what are my needs, what are my wishes, what are my strengths, and if I combine that with what is out there, then my advice would be to develop a vision for the future. That is actually key for innovation, because every innovation happens in the heads of human beings to begin with. Florence Gaub actually wrote a wonderful book about this. If you're interested to learn more, giving people even methodology to really step back and analyze, create different versions of the future, and not all of them look bad, and then work towards some of them that you see in line with your needs, in line with your wishes, and desirable.
This is interesting because I could almost say that if I am feeling that I'm in a situation of threat, I'm perceiving some threat from a change or whatever, I could sort of define my own vision of me, where I want to see myself, and then say, okay, given the circumstances, these are the skills I need to build to excel and to work towards this vision. So it gives you hope, I think.
Correct. Yeah.
Now, if you had to go back in your career and do some things as you did them, but also do some things differently, what would those be?
Okay. So first of all, I'm really happy and so proud that I was able to launch those innovations as part of a team, obviously. I mean, this is brought with me here actually in this is in Wall Street Journal from 2016,
Very cool.
May 17th, and there's a full page ad from SAP in there about ASCO being live. So really showing that we made it, we were able to bring that database together.
We're going to grab a picture of that.
Yeah, perfect. So again, that makes me proud. That is really wonderful that we had that opportunity. I would say, looking back, doing the MBA earlier would have helped me. It was perfect timing for me, obviously, to really launch that second innovation. But I think I would have had benefited from this already earlier. Secondly, what I learned over the last years more and more is that I really enjoy also working with talents. I'm engaged in he for she, impact program and other, did some mentorship, and also as part of a lead for team and managers, bringing out the best in those people, bringing their potential to fruition. That is really something exciting, and that's something which, as part of my day job, so very often, working those innovation means that you really have to work very hard on just getting the basis done. That leaves you very little time to really focus and work with your team. That's something that in hindsight I would do maybe differently, because the overall impact of working with your team more and bring their talent forward, the overall impact would have been even higher.
I think that's a very important point for our audience and also for me as a takeaway, because you explained the lack of time. I think that's something we all suffer under, whether we're a leader, whether you are a manager or not, or whatever. There's a lack of time simply to look at these aspects of talking to each other and saying, hey, I know about this, and, how are you feeling about it? Where are you headed from here? Can I help you? Can I support you with something? We just take out such little time. And this is such an important quality. And I think we need to consciously be aware of that, because if we don't do that, it can have spillover effects onto our behavior. kind of kicking the cat syndrome, if you will, talking aggressively just because we're stressed and we haven't had the chance to process it along with somebody else. So I think this is a very valuable insight. I love it that you shared with us the Wall Street Journal example because it's from 8 years ago.
Yeah.
Amazing. Can you share a little bit about this award as well?
Perfect. Yeah, it's even older. It's it's 25 years old. If you say so. When I started, I was a chemist. So standing in the lab and dealing with all those samples and liquids, that is something that you basically were trained over years. And you can imagine what an amazing notion that is, that you can bring all that lab, all that sample processing, that providing liquids that you need to have to do some reactions, and then basically you had to, whatever you got out of this, do some type of analysis with that, and being able to do all of that on one single chip, that is just amazing. And the potential also is so huge because, I mean, let's go back to that cancer example. Again, cancer samples are absolutely not homogeneous. So in there, very heterogeneous, there are single cancer cells in there which you want to analyze. And such a technology is unique, giving you that opportunity to really understand, what are those specific cells about, what is happening there, rather than basically sampling it all up with even healthy cells and getting an average example. So that is really fascinating.
I think this is really inspirational for the listeners here because it has such a profound impact on people like us. And so with that, I want to also invite you to share some advice with the people listening to us. The people that are working on the products for tomorrow, what advice would you give to them?
Yeah, that's a really important question. So my advice would be work on something where your passion is, where you really want to be accomplish something, as I mentioned before, and it starts with the industry. So which industry do you want to be in? Do you want to do something about sustainability? Do you want to be in the software industry? What culture is predominant in that industry? Is that something you want to be in? I remember those days when I had the opportunity to work for a crop protection company, and basically I felt it's not the right thing to spill chemicals onto soil. I was humble enough to really understand that we don't understand all the consequences on all those organisms in soil. So that is my first advice. Understand which industry you want to be in, which company you want to join, even which department. There's a huge difference in what the different departments do, how they work, even the teams. So take a moment, take your time, step back. Don't take the first offer that you get, or if you take it, that's fine. But then make sure that as you're working there, you already think about the next where you really want to go to really work with passion on whatever product and innovation you will be working on. That would be my advice.
I think that's very good advice because it forces you to look inside yourself and to understand where does your passion even lie. Because even that is something that not everybody knows out of the gate. Not everybody knows where their interest is.
Completely agree.
And sometimes that comes over the course of several years. So this is super, super good advice. And so, Werner, I want to thank you again for doing this amazing interview with us here on this podcast. I've had the honor to speak with you and get so many insights and learn so much. Thank you for being with me.
Thank you so much for inviting me. I know it's really close to my heart to also be able to share some of the insights. Maybe it's helping one or the other person in a situation. So thank you for inviting me.
Thank you. This was the first episode of my podcast, and I really hope that you enjoyed it. I hope that you were able to get some key takeaways just like me. I found it inspiring to speak to Werner, and I'm going to be speaking to many more such guests who have the ability to inspire us all, because that's what we need throughout our professional and personal lives. We need a bit more of that inspiration. So Stay tuned in and look through the list of other guests and tune in to whatever interests you.